Before you mount the cast, make sure that you have your cast indexed. You can do this on the lathe, but make sure that you have cleaned out all the grooves in the burr. You can do that with a knife, or there are some burr cleaning instruments that they have at the window. So we're going to cut indexes in the cast. I like to use the lathe because I think it is faster. And I use the end of that large burr. Come straight across the cast. And you want something that's about 2 millimeters deep. I need to go a little bit deeper on this. This burr will not allow you to get undercuts. That's a good thing about it. Come across. I would not wear gloves on a lathe, but approximately like this, a couple millimeters deep. I don't have a measuring device. It's probably not quite 2 to 3 millimeters in depth. It's easier to do this if you have a dry cast because your burr will not get clogged up. That's looking better. You can see that. And then I'm going to come straight across the form, basically across. Does it matter if I have a perfect in the center one? No, it's not going to make a big difference. Started my cuts. Stop and clean this off a bit. I like to cut the end of my millimeter ruler off back to 0. That way I can put it into the groove and I can see that I'm a little shy of 2 millimeters, so I'm going to take just a little bit more off my cast. So that's the way I index my cast. Now, to do this project, first of all, if you had a patient and you made this occlusion rim in order to mount the case because you couldn't have a stable cast to mount, you may have made this occlusion rim, and then you would actually take a face bow with the occlusion rim in place, and you would use that occlusion rim to mount your case with the face bow apparatus. But what I want you to do is check out one of these mounting jigs, and it will have a number on it. You have to check it out and attach it to the lower member of your articulator. On the upper member, get a mounting plate from the drawers and place it on the upper member of the Whip-Mix articulator, and then take your upper cast. Because it is stable in this mounting jig, you don't have to use the record base to mount that upper rim. Place it securely in the mounting jig that we have given, and again, this is in lieu of the fact that we don't have a way of taking a face bow on our Dentoforms or on our even the mannequins. So we're going to make sure that there's a space between for mounting stone to go. You want to set your pin. There's a dark line on the pin, and that dark line is the 0 point. With the point up, the sharp pointed edge up, adjust your articulator to where this upper horizontal member is at that 0 or dark line. You will have the plastic mounting apparatus on the lower. You can set your side readings to face bow. There's one called FB on there. So place your condylar inclinations at FB. Make sure that this is good and solid. It isn't wobbling back and forth. And if it is, then see an instructor. Before I mount my case, though, I want to place some Vaseline in the indexes so that this cast can be removed at a later time. And I would like to have soaked my cast for about 10 minutes. My cast is wet. I have ready I have mounting plaster in this bowl. They're available in the drawers. And I have 63 mLs of liquid, which is what is called for on the package for this 100 gram package. Make sure that you might want to get with a partner because you don't need all of this to mount one. Two of you can work together. So I'm adding the powder and liquid together. It calls for mixing it for 20 to 30 seconds. I'm going to first put the mounting plaster on there and just get the top member attached to the articulator. While I'm waiting a little bit, I'm going to put some of it while it's nice and running. I'm going to get it into the grooves. I'm going to start to put some on top of my cast. I don't want to get the final attachment all the way out to the sides at this point. I'm just going to get it attached to the upper member, the upper mounting plate. So I have a little bit piled up in the center, and I'm going to close my articulator till my pin comes down now. So I'm keeping it away from the edges because I'm going to come back with mounting stone to fill in the edges, which will be much more attractive. Plaster has a rougher consistency. The mounting stone makes it very pretty, but both of them are fast-setting products. My plaster has now set. While I was waiting for that to happen, I went ahead and got mounting stone and 23 mLs of liquid together in the bowl and in the measuring device. And I'm now going to finish this off. So I'm going to remove the cast that's attached to the articulator. I'm going to finish this off at this point because I can control it better. I don't have to go to the lab as much, and I can work with it very easily. So we're going to mix the water and the mounting stone. Mix it up. You only have 2 or 3 minutes of working time on this material. Mix up. Just mix for 20 to 30 seconds. And then I'm going to start to fill in this area with the stone. As it thickens up, it's easier to work with, but also harder to get into all those cracks. So add the stone. And I'm going to use my fingers, take off some of this excess here, back to the sides of the cast. Back to the mounting plate. It's easier to work this in 2 steps and easier to get a nicer result than if you try to do it all in one. I'm done working with it at this point like this, and I'm going to come on over to the faucet. There's a sponge available for you right here. I'm going to take that sponge and take this back. To my cast and finish it down. If it's not quite to your liking, that material is probably still a little bit soft that you can add into places if you'd like. And still, if you take too much away with your sponge, you can add it back in there and do a finger polish instead of with the sponge. Get it level to the outside of your cast. Actually, I think the finger does a nice job. Makes a nice smooth surface. Get it off your cast for sure. Got a little bit on my canines. I have a little bit overlapping onto my mounting ring, so I'm going to go ahead with this. At this point I can take that buffalo knife, bring it back, and then just smooth my edge up right in that area. Take it off of my cast if it's tending to want to stick to your cast. Get it off the sides of your cast. There again, that's where this sponge will do wonders, taking it off the sides of your cast. And just your finger and this plaster, you can get a nice job. You want to make sure it's off your cast, back to the cast. You want to be able to see those indexes, because the laboratory will look for the indexes. If they're not, they may send the case back to you. So that's all you can ask as far as neatness for a case that's mounted. You go back onto the articulator, and you're now ready to do what's necessary to mount the lower member to your articulator. In looking at my upper, I've already removed some of this, but again, using that buffalo knife, you can get into that area, and usually it'll kind of just almost pop off. You can use that buffalo knife and come around these edges, use the buffalo knife, come around these edges, and you can pretty much get rid of that wax that's into those embrasures. The cleoid discoid worked very well to get those areas cleaned out in the embrasures and actually to clean around the cervicals. So you should get rid of all that wax that's on the cast. Just trying to show you some different methods of achieving cleaning up your cast. I like to have a bristle brush, one of these handy, that I don't have Vaseline on or anything, but it comes in handy to clean some of these particles off and see what I'm actually working with. I now have the upper member attached to my articulator. I'm now going to go back and take my occlusion rims back to my patient. And as you can see, when I close my two rims together, the teeth are far from being able to touch. I'm now going to adjust my rims until there is about a 3 millimeter space between the wax rims when I had the teeth in contact with one another. The first thing I'm going to do is to make sure that I heat my hot plate with my Bunsen burner, but the hand-out torch will work just as well. And I'm going to make sure that my anterior rim is down to the level of my two canines. I'm trying to hold this so that the excess wax will drip off onto my paper and not get dripping down the cast. Next, I'm going to adjust that anterior wax, not touching the anterior portion because it's telling me the length that the teeth should be in that anterior area, but I'm going to remove that wax behind it until my teeth can come in contact. And to do that, I'm going to use my spatula, put it back on the cast to work on it, and I'm going to be reducing this wax right through this area, but not out to the incisal edge. And there's not much I can do but run onto my base plate to adjust this down. But I'm going to get this down to where my teeth will touch. But you would take your base plate off. This one being triad, you don't have to worry about the heat. So you could take the base plate out of the patient's mouth and adjust this down until the patient can get his teeth together. I have to maybe come out a little more labial in that area. Some people might soften that wax rim and make that move downward by letting the patient bite into the wax rim. The only problem that you sometimes have is that that rim slides off. Now my back teeth are coming into contact with the opposing arch. teeth are in contact. I'm going to place this on the upper dentiform, and I'm going to adjust the lower to this one. When I close my teeth together, I'm propped way, way open. So I have a lot of wax to reduce back in this area. I didn't suggest working with this material off the cast because it's heat sensitive. I would put it back on my cast. For every millimeter you reduce in the posterior area, theoretically that will lower vertical dimension by about 3 millimeters. I'm going to get rid of some of this back. And remember, I want 2 or 3 millimeters of space. So I have a ways to get that down. What I saw was not enough room between this area over on this side and the upper part of the dentiform, and not quite enough room in this area. So I'm going to take some more off of both areas. I'm going to try and make sure I have a couple millimeters of space between my upper rim and this lower area. I'm removing it a little more on this side because I had some space, but not a satisfactory amount of space between my upper dentiform teeth and this lower rim. I'm almost all the way back to my sticky wax. And is that a problem? Not if that's what it has to be. When I made my rims, I didn't have a patient handy. So I have reduced to where I have a couple millimeters of space. I'm going to clear that part toward the premolar out just a little tiny bit. And on the other side, I also have about a 2 to 3 millimeter space. I'm just going to clean up these rims just a little bit. I'm going to place compound on the lower rim back here and here. Now, indices are not necessary on these areas, but I might sometimes put a couple of them in there because if your compound would pull loose, you have a place to put it right back in. If you put it in those grooves, you know exactly where it goes. I'm going to place a couple of indices right in here. Now my teeth will be recorded in this area below. On this upper rim, I'm going to cut 2 non-parallel V-shaped grooves, or equilateral triangular shaped grooves. I tend to heat my buffalo knife, and I use it and I cut one groove a little more anteriorly, and I want a V-shaped equilateral triangle about 2 to 3 millimeters in depth. Then I come back a little bit farther, and I don't want them to be parallel to one another, so I'm going to go off parallel just a little bit, and I'm going to cut my second groove. Yeah. This one is a little bit on the skinny side, so I'm going to open that up just a little bit. It's too narrow. I want a V shape like an equilateral triangle. On the lower, we don't necessarily need indices, but I'm going to go ahead because if my record would come off, if I have that indices in there, there's no way I can't get it back into exactly the same spot. I have some decent indexes on the top. I happen to put a couple little grooves in the lower. Place Vaseline on the upper rim, the tooth in front of and in back, and on the patient's teeth, okay, so that when I put compound on the lower, it does not stick to the opposite member of my dentiform. I really want the compound to stick on the lower. Then I'm going to place my compound and close my articulator together to record the jaw registration on my patient. After you place the compound on the dentiform, you want to make sure that you have enough height on that in order to record all the way up into those grooves that you have on the opposing arch. Place it, make sure that there's enough in that area. It's all been cooling a bit. take your Hanau torch and reheat the surface of your compound. Reheat the surface of your compound. Temper it in a water bath to bring it down to the 140 degrees on the surface so that you don't burn your patient. Put it up in a stack like that. Bring it to your patient. Seat it on your Dentoform. Make sure it's totally seated. And then close the Dentoform until the teeth are in contact. Now at this point I like to put my finger in the patient's mouth and I just try to smooth this compound a little bit in the patient's mouth with a wet finger. And I want to make sure that it's getting up into those grooves, and I want to make sure that it's touching those other teeth. I'm smoothing it off a bit so I have less trimming to do. You don't want this material to wrap all the way around those cusps, because then you won't be able to remove it from the patient's mouth without. It has now cooled. I'm going to hold on to your record base and open up the Dentoform, and you see a record. You want to trim that record back to where you can actually see the teeth occluding and when they touch the bottom so that you can check. Now this material is in front of my teeth. You can almost see where there's a little lip where it turns up on the teeth. So I'm going to take my barred Parker blade and I'm going to take that little lip off. That's it. The other thing I'm going to take off, I've got a big old guide plane back here. I can't miss when I try to repeat that record because that wax is too tall. So I'm going to take that down to where only the occlusal surfaces of the teeth are recorded. And I have that pretty good there. Then I'm going to shave this off back here just to where it's confluent with my wax. Taking some of this back off because really there's soft tissue back behind those teeth and it might affect checking your registration if it interferes with soft tissue. On the other side, I had very little overlap, so I might just take a smidge off right there. And I'm going to try and bring the lingual back to the level of the wax so it doesn't interfere with the patient. And if you notice, I have brought the front back to where it's flush with the cups tips. When I go to check a person's bite, I'm looking to see whether the back and the front are touching at the same time, ensure that the left side and the right side are touching at exactly the same time. I can't do that if this compound is in front of the wax because you can't see. Once it gets to a certain point, the rim disappears behind the wax and you can't tell whether that registration is accurate or not. I have placed my upper rim back on the cast, back onto the articulator, and I've placed my lower rim back on the lower cast. I'm now going to put the two together and see how they hand articulate, and those teeth should be touching. It should look basically the same thing on this as it looks on your articulator. I had some wax that ran over onto the occlusal surfaces of my teeth, and I have one bleb down in the fossa, which is where that cusp will occlude, that could be holding me up when I put the two casts together. Now when I hold the cast together, it looks the same on my two casts as it looks on the Dentoform. Ensure that the casts do not move while I am mounting them, because if you see this under the weight of the material, you could get your mounting off. I'm going to secure these two casts. I'm going to cut a couple of these cotton tip applicators off and secure them with sticky wax or compound to the side of the cast. The text recommends the metal strips, which would be a coat hanger cut up into strips that are attached to the sides of the cast. Hold the cast together, apply a little sticky wax and get one of the sticks stuck to the sticky wax, and then go ahead and add enough sticky wax to hold the strut in place. These little struts are cut about 55 millimeters in length. Some people in our text recommends using coat hangers because they're much more rigid. You can take an old coat hanger, one of those metal types you get at the cleaners, and you can attach and secure the cast with them. They're more reliable. You can also use compound to secure those sticks, to secure your cast. So you may use compound or sticky wax. I honestly think I like this compound. It's less messy. To see which one I like. Sticking that stick back on there, showing you that you can use either one, and you can use the metal rods. And now I'm ready to mount my case. I'm going to close it just to check to see if I have enough room in there for stone. And I'm going to place a little bit of Vaseline in my groove. Place my powder for the mounting plaster in the bowl, and I'm going to try 60 mLs of water instead of the 63 it calls for, because it was awfully runny last time, but it may affect my working time. So I'm adding the water to the powder, mixing it, and even with 60, it's extremely runny at this time, and they say mix it for 20 to 30 seconds. I'm going to add a little bit to the cast. I'm going to add some into the grooves of the mounting plate. And I just want to capture it on the cast. I don't want it to go out to the sides. I just want to get it stuck on the cast. And the space there was pretty tall, so I'm placing some of this in here. And I'm going to close my articulator onto this. Now I'm getting an experiment here. I'm going to clear it back so that I can finish off my cast nicely. So I'm taking it back away from the edges, taking it back away from the edge of my mounting plate so that I have room to put the nice stone in there. So I'm working it back so the edge of my cast is exposed. It does shorten my working time, I can tell from the last time that I did it. And I'm going to let it set. I'm now able to go ahead and take off my mounting sticks that I had used, and I'll clean up my cast at a little later time. I'm ready to actually take the lower cast off of the articulator, and I'm going to finish off the rest of this off the cast. Before I do that, I'm going to clean a little bit of this stone off of here. And again, I'm making sure that I have a little room to add material down to my mounting plate. I'm going to check one more time now that I've mounted it that my mounting looks like my articulator and my registration looks correct still, and it does. I'm now placing 26 mLs of water with one package of mounting stone, Whip Mix mounting stone. Mix it. For 30 to 45 seconds. Getting it into these areas. Like I said, I don't really want it to run off. I'm not having any trouble with it running away from me. I do want it to come out to the edge of my cast. I don't want that to be a knife edge out there, because when I go to separate it, if it's a knife edge, those edges will break off. So I want it to kind of go straight up from the cast. Starting to get there. I'm then going to take my water stream and I'm going to wipe it back to the cast. Wipe it off back to the cast. And I'm going to wipe it off the mounting plate back to the seam. the polishing. Finger does a nice job. Real light touch. I'm not touching it very hard. Just with finger polishing, I've had a pretty good success. Now I'm just using my knife to take this little bit of excess off that has gone down my mounting plate. Using that sponge to get the last bits of material. One side of this sponge is harder than the other. I'm using the rougher one to get it back off the mounting plate. This should be about the end result. That looks just fine. I'm going to put it back onto the articulator and see what I have. Looks like I have a successful mount.